2 cases of the fatal pneumonia plague have been confirmed in China.
The Zika outbreak,
Ebola,
the AIDS epidemic,
measles.
An epidemic, either naturally caused or intentionally caused, is the most likely thing to cause, say, 10 million excess deaths.
We're not yet close to where we need to be prepared for the next epidemic.
In October 1982, a pesky journalist named Lester Kinsolving took his seat in the Reagan White House briefing room. A string of deaths had been recently reported by the Centers of Disease Control, attributed to a new disease called acquired immune deficiency syndrome, or AIDS. Lester couldn't have known then that AIDS would eventually take the lives of 25 million people worldwide, but he did know something was wrong. White House spokesman Larry Speaks, of course that was White House spokesman's name, fielded his questions. Have a listen.
Does the president have any reaction to the announcement of the Center for Disease Control in Atlanta that AIDS is now an epidemic in over 600 cases? And over a third of them have died. It's known as gay plague. No, it is. I mean, it's a pretty serious thing that 1 in every 3 people that get this have died, and I wonder if the president is aware of it.
I don't have it. Are you? Do you?
You don't have it. Well, I'm relieved to hear that, Larry.
Do you?
No,
You didn't answer my question. How do you know?
Does the president, in other words, the White House looks on this as a great joke.
By the end of 1984, scientists had concluded that AIDS was the product of human immunodeficiency virus, or HIV, and by then, nearly 300,000 people had been infected. Yet President Ronald Reagan hadn't mentioned the disease publicly at that time, so in December of that year, Lester pressed the White House again with more questions.
An estimated 300,000 people have been exposed to AIDS. Is the president concerned about this subject, Larry? No, but I mean, is he going to do anything, Larry?
Last I have not heard him express anything. I'm sorry.
He has expressed no opinion about this epidemic?
No, but I must confess I haven't asked him about it.
Would you ask him, Larry?
Another 3 years passed before President Reagan would deliver his first major speech on AIDS, and by then, more than 500,000 people had been infected. It was a major public health crisis, which even today still kills hundreds of thousands worldwide. So why did it take so long to address? The reasons have as much to do with culture as they do with preparedness. The stigma of intravenous drug use and even bigotry, you heard them laugh when Lester called it gay plague, all kneecapped America's response. These days, the challenges facing pandemics have evolved. As new diseases spread, so does fake news. Remember those anti-vaxxers who claim vaccinations were linked to autism? They're still out there, and they're fanning social media flames and sowing distrust of health officials. And priorities shift. It usually takes a crisis to readjust focus. If you look at Ebola, back in 2014, Congress approved a $5.4 billion emergency package to fight the virus in West Africa. The idea was to get to the source, which is usually cheaper and much more effective than fighting the virus once it's spread, and it was. The move helped limit the death toll to under 20,000 people compared to the hundreds of thousands that experts predicted. But that doesn't mean Ebola is gone. The World Health Organization recently declared an international emergency in the Democratic Republic of Congo, the second largest Ebola outbreak on record, more than 3,000 cases, 2,000 deaths. Also accused Tanzania of covering up a new suspected outbreak. Meanwhile, over here, Americans are covered, right? I mean, after all, the president of the United States is an avowed germaphobe.
I'm also very much of a germaphobe, by the way.
But the top White House official in charge of pandemic preparedness has left the job. That means there is no longer a senior administration official focused squarely on global health security. His unit was also disbanded. Sit with that for a moment before considering this. An outbreak can spread to any country on Earth in less than 36 hours. It's a flight or two away. A successful response demands coordination with multiple partners across multiple regions. It's a rapid assembly line that includes medical boots on the ground, local community groups, media campaigns, swarms of epidemiologists, that's what we officially call them, swarms, GPS systems to track potential cases, stockpiles of medicines and vaccines, and an effective distribution mechanism. In other words, pretty much the opposite of this.
He has expressed no opinion about this epidemic?
No, but I must confess I haven't asked him about it.